Did you just get your MRI results back and find out that you have an L4, L5, or an L5-S1 disc bulge? If so, you probably have a lot of questions. In this video, we're going to do our best to answer those. Hi, I'm Dr. Daniel Bridge. I'm a chiropractor in Helena, Montana, and this channel is dedicated to providing you with tips and strategies to maintain your spinal health as well as lead a pain-free life. A bulging disc in your lower back is a common condition that many people around the world deal with. It causes significant pain and limitation. Before we get into the specifics, let's go over the structure of the spine. Your back is made up of 24 bones called vertebrae, and in between each bone is a disc. A disc enables our spine to flex and to bend and to rotate, so it's not just one big solid bone. And what we're focusing on today are the lower two discs in your back, in your lower back. Your lower back is made up of 5 vertebrae, L5, L4, L3, L2, and L1. And then the bottom right here is called your sacrum. So once again, we're focusing on your L4, L5 disc, as well as your L5, S1 disc. The S1 stands for the sacrum. Those are the two most common discs that get herniated or bulged. A bulging disc is when the disc moves outside of its normal boundary. There are several different things that can cause a disc in your lower back to bulge or to herniate. The first process we're going to discuss is what I look at as little by little, or I like to think of it as the straw that broke the camel's back. I've had patients that come in and say, "Doc, I bent down to pick up a pencil off the ground. Instantly I had intense pain in my back and shooting pain down my leg." Now, they've probably done that motion 100 or 1,000 times and been just fine. But if you zoom in, what happens each time you do that is little by little, the disc starts to weaken, the walls of the disc start to bulge. A disc is made up with cartilage on the outside that is strong and rubbery, and on the inside, it's a toothpaste-like material. And little by little, you can cause that toothpaste-like material to keep banging on the outside of that disc, stretching that out, and one movement, like picking up a pencil, can cause that to herniate and to bulge, to butt up against that nerve, and to really start to cause that sciatic pain. So you really have to think about your posture, the way you're bending, the way you're lifting. The worst movement you can do for a disc is when you bend and then you twist. So if you're working, you're picking up heavy items and putting them into the back of a pickup truck, for example, you need to be very careful. You need to use proper lifting posture, because those movements can really cause a disc to bulge. The second thing is you could actually have a very healthy disc and have a very traumatic incident that causes it to bulge instantly. So maybe you had a slip or a fall, or you got into a high-speed car accident, or once again, maybe you bent down to pick something up really heavy, and with bad mechanics, you lifted and you twisted, and you can cause that disc to herniate or to bulge. I'm now going to demonstrate the difference between proper and improper lifting mechanics. When you need to lift something, the wrong way to do it is you're going to really hinge at your lower back, where you're going to round it. You're going to round your lower back, you're going to pick something up, and you're going to use your back to lift it up. Do not do that. Once again, especially with a twist, which looks like this. You're bending, you're picking something up, and you're twisting. That's a really easy way to hurt or re-injure a disc. The proper way is you really want to use your knees and your hips, and you want to keep your lower back straight. So if I was going to pick something up, I bend at the knees, keep the back straight, grab what I'm looking for, and then just pick it up. That way you're able to minimize that flexion on that lower back disc. There are several symptoms that you can be dealing with when you have that bulging disc in the L4, L5, L5, S1 area. Because of that, it can be fairly difficult to diagnose without an MRI. You can have pain just there in the lower back, and when it gets more severe, you can also have numbness, tingling, and weakness, as well as pain going down that leg. The sciatic nerve is the biggest, longest nerve in the human body. It starts here in your lower back, and it travels down the leg all the way down into the foot. Now right here where it forms from, including the L4, L5, L5, S1, the nerve roots that come out of there, and then they form into this massive nerve. So when you have that bulging disc, and it's impinging upon those nerves that form into the sciatic nerve, that's where you're going to have the pain. So it's typically going to go down the back of your leg all the way down to the foot, but it can also wrap around to the front of your thigh as well as the front of your lower leg. Numbness, tingling, burning, and when it gets bad enough, that's when you start to get the weakness to where it's harder to walk, maybe your leg feels heavy, it's hard to lift that leg up, because what's happening is with the bulging disc compressing on the nerve function goes down and it's no longer able to transmit those signals to the muscles to do their job. And that's when people start worrying about nerve damage. So it is something that early intervention can be important in taking care of this issue. One of the main questions people are asking at this point is, how do I get rid of the pain? What do I need to do? And how do I get this fixed? Of course, it's case by case. And yes, severe cases will require surgery. The good news is that many people will respond very well to conservative, non-invasive care. In our office, bulging discs is something that we deal with on a daily basis. The first thing that we do for our patients is something called decompression therapy. We have a specialized table that helps to stretch and decompress that lower back, that L4, L5, L5, S1 disc area, taking pressure off the nerves, increasing the space for those discs. It's highly effective and it's very comfortable. When you add in other therapies such as class 4 laser therapy, shockwave therapy, we also do chiropractic adjustments and specialized exercises just for this condition, it gives our patients a very good chance of overcoming this condition without the use of something more invasive and less conservative. If you still have any questions about an L4, L5, L5S1 disc bulge, make sure to leave those in the comments. I will answer them all. Also, make sure to like this video, subscribe to our channel so you don't miss out on any other health tips and strategies.